Asperger syndrome is a form of autism, which is a lifelong disability that affects how a person makes sense of the world, processes information, and relates to other people. Autism is often described as a spectrum order because the condition affects people in many different ways and to various degrees.
Asperger syndrome was originally described by Dr. Hans Asperger in 1944. He provided an account of a number of cases whose clinical features resemble Dr. Kanner's description of autism in 1943.
Asperger's description differed from Kanner's in that speech was less commonly delayed, motor deficits were more common. The onset appeared to be somewhat later, and all the initial cases occurred only in boys. Asperger also suggests that similar problems could be observed in family members, particularly father.
Asperger syndrome is mostly a hidden disability. This means that you can't tell someone has the condition from their outward appearance. People with the condition have difficulties in three main areas. They are social communication, social interaction, and social imagination.
People with Asperger syndrome have fewer problems with speaking. They do not usually have the accompanying learning disability associated with autism, but they may have specific learning difficulties. However, with the right support and encouragement, people with Asperger syndrome can lead full and independent life.
People with Asperger syndrome sometimes find it difficult to express themselves emotionally and socially. They may have difficulty understanding gestures, facial expressions, and difficulty knowing what to start or end in a conversation, and choosing topics to talk about. They will use complex words and phrases, but may not fully understand what they mean.
Many people with Asperger syndrome want to be sociable but have difficulties with initiating and sustaining social relationships. People with the condition may struggle to make and maintain friendships. They do not understand unwritten social rules that most of us pick up without thinking. They may also behave in what may seem an inappropriate manner.
People with Asperger syndrome can be imaginative in the conventional use of the word, like imagining alternative outcomes to situations and finding it hard to predict what will happen next. Some children with Asperger syndrome may find it difficult to play let's pretend games or prefer subjects rooted in logic and systems, such as mathematics.
The exact causes of Asperger syndrome are still being investigated. However, research suggests that a combination of factors, genetic and environmental, may account for changes in brain development. Asperger syndrome is not caused by a person's upbringing, their social circumstances, and is not the fault of any individuals with the condition.
There is currently no cure and no specific treatment for Asperger syndrome. Children with Asperger syndrome become adults with Asperger syndrome. However, as our understanding of the condition improves and services continue to develop, people with Asperger syndrome have more opportunity than ever of reaching their full potential.
Even though there is no cure and specific treatment right now, there are many approaches, therapies, and interventions which can improve an individual's quality of life. This may include communication-based interventions, behavioral therapy, and dietary changes.
The typical route for getting a diagnosis is to visit a general practitioner. He or she can refer an individual to other health professionals who can give a formal diagnosis. Most frequently, they will be psychiatrists or clinical psychologists, and in the case of children, pediatricians.
Given the complexity of the condition, importance of the environmental history, and common difficulties in securing adequate services for children and individuals with Asperger syndrome, it is very important that parents are encouraged to observe and participate in the evaluation.
The doctor often seeks input from the child's parents, teachers, and other adults who are familiar with the child's symptoms. The diagnosis is based on the child's level of development and observation of child's speech and behavior. Evaluation findings should be translated into a single coherent view of the child. Easily understood, detailed, concrete, and elastic recommendations should be provided.
A comprehensive assessment will involve in the following components: history, psychological assessment, communication and psychiatric assessments, further consultation if needed, parental conferences, and recommendations.
Because these students have difficulty learning in a traditional manner, depression can ensue. The capacity to acquire information is present, but performance is hindered. A depressed student will undoubtedly have some kind of academic struggles. For these students, depression is just one more barrier to education.
Kumai and other indicate that teach has four elements. These elements include the physical structure of the classroom, a visual schedule of the day activities, an explanation of the type and length of the work expected, and an instruction presented visually in addition to verbally.
Osnov and others elaborate on the suggestion of visual signs for Asperger syndrome students. The research claims that visual instruction and schedules help students to feel more secure and less stressed so the mind can direct its attention to learning.
Osnov and others also suggest that the student's strengths be maximized. Other scholars suggest a program that accomplishes the idea of maximizing students' strengths as well as increasing self-esteem by using the student's preoccupation with one individual's topics.
It is effective because these children are really bright but frustrated with traditional education environments. Different instructional techniques offer opportunity to be excited about learning as well as the chance to learn about individual abilities and how these abilities can be applied to the classroom environment in which they learn.